So, good day everyone. Today we are going to talk about the mumps virus or the epidemic parotitis or beke sa Tagalog. So, mumps virus or the epidemic parotitis became nationally notifiable in 1968, and after the use of the mumps vaccine, yung cases began to decrease rapidly. So, through vaccine, mabilis pong bumaba yung cases ng virus. So here are the table of the contents or the contents of this topic. So we have the introduction of the disease, the signs and symptoms, source of infection, modes of transmission, pathology, and the prevention and control measures. So mumps is a viral illness caused by a paramyxovirus, which is a member of the virus family. So mumps po, or again, Beka sa Tagalog, is caused by a virus called the paramyxovirus member of the virus family. So the paramyxoviridae subfamily is divided into three genera. The paramyxovirus type of the human influenza. Next is the morbillivirus, which is a type of measles virus. And last is the virus type of the mumps virus. So the virus that affects the mumps or this viral illness is caused by the first and third subfamily of paramyxoviridae, which are the paramyxovirus and the rubella virus. So, mumps is an acute self-limited systemic viral illness which is characterized by the swelling of one or more of the salivary glands, typically the parotid glands. So, again, from the previous slides, I mentioned that this is a viral illness. So, this time it is characterized by swelling or inflammation of a person's salivary glands. Inflammation po is yung pamamaga. So specifically, the parotid glands. So it can be one or more of the parotid glands na pwedeng ma-infect ng virus na ito. So we have three major pairs of the salivary glands, the parotid glands, the submandibular glands, and the sublingual glands. So these three parotid glands, major glands rather, can be found around our mouth and the throat. So the parotid glands, which affects the virus, is located in front and beneath of the ear. So dito po part. So as we can see from these pictures, we can tell the difference between the person na may mumps at nung wala pa silang mumps. So we can easily identify the person having mumps by means of only looking at them physically. So, makikita po natin sa picture na namamaga po yung both the parotid glands of the patient and yung both cheeks po nila. So, in their cases, the mumps can cause more severe complications. So, nagkakaroon po ng complications or komplikasyon yung mumps virus or yung beke na akala natin simpleng pamamaga lang ng cheeks. So, this includes orchitis o ophoritis, mastitis, meningitis, encephalitis, pancreatitis, and hearing loss. So, the complications can occur in the absence of parotitis and occur less frequently in vaccinated patients. So, kapag daw po ang patient is vaccinated, hindi nila mararanasan magkaroon ng complications kasi meron silang pangsangga or panlaban dun laban sa virus. So, some complications of mumps are known to occur more frequently in adults than children. So, yung complications daw po is mas nag-o-occur sa adults, rather than sa mga bata. So, excuse me, the meningitis or encephalitis is inflammation of the membrane na nagko-cover po sa ating brain and the spinal cord. Ang orchitis naman po is inflammation of one or both of testicles. Mastitis is inflammation or pamamaga ng breast tissue. Parotitis, ayun po yung pamamaga ng ating parotid glands. Ophoritis naman po is the inflammation of one or both of the ovaries. And pancreatitis is the inflammation of pancreas and deafness po or pagkabingi. So, mumps virus is a paramyxovirus in the same group as parainfluenza and Newcastle disease virus. The virus has a single-stranded RNA genome and can be isolated or propagated in cultures of various human and monkey tissues. The rubella virus can be isolated in viral culture from the saliva, urine, and cerebrospinal fluid or the CSF and other chemical agents. So again, from the previous slides, I mentioned that mumps is caused by a virus called the paramyxovirus along with the rubella virus. So, nagkakaroon po ng cross-reactivity or nagkro-cross-react po yung mumps virus. So, yung cross-reactivity po happens if the antibody of a person na may mumps is na-defend ang body from invaders or yung tinatawag po nating antigens. So, pagkatapos po ma-defend ng antibodies ng isang tao laban sa mga invaders, ang nangyayari po is, excuse me, nagiging nakikilala or natatandaan nung antibodies yung antigen na pumasok sa atin because they have the same structure. Ayun po. So here are the signs and symptoms and let me read. Mumps is best known for the puffy cheeks and swollen jaw that it causes, fever, headache, loss of appetite, muscle aches, and tiredness. So the symptoms typically appear 16 to 18 days after the infection, but this period can range from 12 to 25 days after the infection. Again, it is common in children, pero it can also occur in adults. Pero in terms of its complications, mas madalas po itong nangyayari sa mga adults kesa sa children. So some people who get mumps or acquire the virus have very mild symptoms like colds or sometimes no symptoms at all. Ay, sorry. So this is the source of infection. Ayan. Common source of infection pa rin po ay ang paramyxovirus. And again, madalas po itong mangyari both in children and adults. So the modes of transmission. Mumps is a contagious disease caused by a virus and spreads through direct contact with saliva or the respiratory droplets from the mouth, nose, or throat. An infected person can spread mumps from a few days before their salivary glands begin to swell up to 5 days after the swelling begins. A person with mumps should limit their contact with other during this time. So again, this virus is very contagious. Mabilis po itong makahawa. So, it spreads through direct contact or the saliva, yung pag umubo, tapos natalsikan ka ng laway. So, pwede pong ma-acquire ng person, excuse me, na walang mumps galing sa infected person. So, ayan, these are the following modes of transmission on how the virus spreads throughout. So, the coughing, sneezing, or talking without any tissue or handkerchief. So, next, sharing items that may have saliva on them, such as water or bottle cups. So, again, through sharing, hindi naman po natin malalaman if the person is healthy, even if it is a member of the family or friends and so on. And lastly is participating in close contact activities with others, such as playing sports, dancing, or kissing. So ito pong last mode of transmission is hindi po talaga pwedeng hindi magkaroon ng close contact or physical contact, especially ang mga athletes na into sports and dancing. So, here sa country natin kapag nung mga bata pa tayo 'pag nagkakaroon tayo ng beke, nakikita natin na nilalagyan siya ng, tina or yung parang yung kulay blue para ma-identify na that person has, mumps or merong beke. So, yun. The pathology. The virus is acquired by respiratory droplet transmission and replicates in the nasopharynx and regional lymph nodes. During viremia, The virus spreads into multiple tissues, including the meninges, salivary glands, pancreas, testes, and ovaries, and sometimes yung pagkabingi nga po. So again, this virus is acquired through the respiratory droplet transmission that leads to some complications and sometimes death kapag hindi po naagapan yung complications. So during viremia daw po, the virus spreads into multiple tissues. So kumakalat na po yung virus sa iba't ibang parte ng katawan. So the term viremia po is used for viruses na present sa bloodstream ng isang tao. So, ang pag-spread po ng virus sa multiple tissues, dito po tayo nagkakaroon ng complications na pwedeng mag-occur sa mga adults, although it rarely happen. So, hindi pa rin po dapat tayo maging panatag kapag nagkaroon or na-acquire natin yung peke, hindi po natin pwedeng sabihin na, wala lang yan, gagaling kaagad tayo dyan. No. Kasi hindi po natin alam na more than that, pwede pong magkaroon or mag-occur into further complications and leads to death. And lastly, or last slide po, which is the prevention and control measures. So the immunization with the combination vaccine of measles, mumps, and rubella or MMR on time is effective way to prevent the mumps. And apart from 2 doses of MMR vaccine, the following preventive measures to reduce the spread of infection includes: first, avoid direct contact with the person infected with mumps. Do not go to school or workplace until the infection is completely healed since this virus is very contagious nga po. Next is to ensure to cover the mouth and mouth while sneezing or coughing. Pandemic. Ang first or number one rule is to always wash your hands thoroughly with water and soap. Yeah, so that is the last slide of our topic. And again, thank you for listening, and I hope you gained some new knowledge to share with your family and friends. So, thank you for listening. Have a great day, and see you next uh, video. Bye bye.